The story of the surgeon who performed his own operation with his own hands. Usually, whenever a person experiences any pain, he immediately goes to the doctor for treatment. But if the doctor himself falls ill, and there is no other doctor available to treat him, then he has to treat himself. The treatment is understandable, but if a doctor performed his own operation, you may think that we are crazy, when in reality, a surgeon did the same thing in the past to save his life. This incident is from 1960, when Russia sent a 12-member team to the harshest weather conditions of Antarctica. The purpose of this team was to conduct research regarding establishing a base camp in Antarctica. It was a one-year trip for which they traveled by ship for 300 days and reached here, and it was not possible for any team to arrive before a year to take them back. A member of this team was Dr. Leonid Rogozov, who was included in this team as a doctor. The 27-year-old doctor initially complained of lethargy and fatigue due to the harshest weather conditions of Antarctica, which over time turned into severe pain in the right side of the abdomen and vomiting. The doctor realized that this was his. All the symptoms were actually pointing to appendicitis, the only treatment for which was surgery. But the question was who would perform the surgery. As Leonid was the only doctor in the 12-person team, to save his life, Leonid made an unprecedented decision in history. He chose two of his team as his assistants and decided to perform the operation himself, for which he placed a mirror in front of him, so that he could see the surgery being performed. Usually, complete anesthesia is administered before surgery. But when the patient has to perform the operation himself, then complete anesthesia is not possible. For this reason, Leonid thought it best to only numb the surgical site and injected an anesthetic injection at this site, first cutting the upper layer of the stomach and then the lower layer, which caused severe bleeding. After that, the biggest problem in performing the operation after looking at the reflection in the mirror was the difference between the right and left. Along with this, due to severe pain, Leonid had to stop the operation repeatedly and rest. His assistants were delivering instruments to him and were also arranging the light. After some time, the most important step was to remove the affected part of the appendix from the intestines and separate it. When the doctor removed this part, its lower layer had turned black and could burst at any time. But Dr. Leonid's correct decision saved his life. After that, the process of applying stitches with the help of his assistant was no less difficult. But after successfully completing this too, Dr. Leonid succeeded, and thus, in this 2-hour operation, he made history.